Good day, everyone. In this video, we are going to continue the discussion on the heart disorder. In the previous video, we have introduced the 5 heart deficiency syndromes. The 5 heart deficiency syndromes sometimes are the foundations of these disorders that we are going to introduce now. The first one is the blockage of the heart vessels. The blockage of the heart vessels can be due to different factors, such as stagnant blood, phlegm, in cold, that just means the coldness, or the qi stagnation. So that's the possible causes of a blockage heart vessels syndrome. And these, according to different causes, the manifestation also can be different. That's the foundation of these factors is based on the heart deficiency, especially the antipathogenic qi deficiency, especially for the heart in the heart deficiency. That's why the deficiency will result in a stagnant blood, or phlegm, or coldness, internal coldness, or qi stagnation. As you can see, these factors are the pathological factors of the pathological condition. So that's the pathological products of the pathological conditions. So these are the theory we study in the basic theory. What's the possible causes of a stagnant blood? What's the possible causes of the phlegm? So if you don't remember this, you can revise the basic theory, and from here we're going to focus on the symptoms and this syndrome. According to different reasons, manifestations will be different, but what's the same is the heart. It must present with the heart problem, especially the chest tightness or chest pain. Pain can radiate to the shoulder and back. So it is referral pain. The patient sometimes will tell you that's the pain. They can feel the pain at the back. In severe cases, the patient may experience pain radiate to the back, or the backache radiating to the chest. In some common situation, the patient also can feel toothache, which means the chest pain radiates to the teeth. So this patient will go to the dentist, and then all of a sudden they find out that it was a heart attack. So for this kind of pain, we need to be careful. Other symptoms can be palpitation, shortness of breath, panting, difficult to lie flat. That's also the signs of the heart problem. And then when we try to identify what's the possible causes, we're going to use the other symptoms. These symptoms are the heart symptoms or the heart-related symptoms, and then we use such as stabbing pain at night, dark purple or spots, sweaty, hesitance, regular or irregular, intermittent pulse. What's the possible cause of these manifestations? Also, the patient may present with the chest pain. The pain feel like stabbing pain. That's from the stagnant blood, or blood stasis. That's the very typical manifestation of stagnant blood or a blood stasis syndrome. The patient also may present with Zang, chest tightness, chest pain, obesity, perfumed phlegm, fatigue, heavy sensation of the body, greasy coating, slippery pulse. So that's due to the phlegm or the phlegm and dampness. Patient can present with severe pain, worse with cold, alleviated with heat, cold lumps, pale, dark tongue. So this is due to the coldness. Patient may present with distending pain, that's chi stagnation, distending in the ribs area, in the chest area, frequent signing. That's a very typical symptom of chi stagnation. A wiry pulse. That's also the symptom of the chi stagnation. So for this blockage of blood vessels, the heart blood vessels, you can see that there can be many different manifestations. But most importantly, chest tightness, chest pain, plus the blood stasis syndrome, or phlegm syndrome, or the cold syndrome, or even the chi stagnation syndrome. This situation is very commonly happens also in the heart attack. When I said the heart attack in the general terms of heart problem, it can refer to angina or the acute myocardial infarction. So in clinics, when you see this syndrome or the patient present with the chest pain, especially for severe chest pain, you need to be careful that is it an angina or the acute myocardial infarction, because the treatments, also the severe, how severe they are will be very different, and the prognosis of them also will be very different. The hyperactivities of heart failure. This syndrome you also can call the heart failure syndrome. This syndrome refers to the excessive heart failure. Excessive heart failure. Now I want you to think about the fish again, the fish pot, the fish tank, and the fire. The heart fire, which means the fire at the bottom got excessive fire, so the water in the tank going to be warm, disturbing the mind, disturbing the heart spirit. So it will affect the mind, insomnia, fever, sweating. The vexation, I more prefer to use the irritation. So that's due to the heat in the heart. So you also can use the previous words, restlessness or irritation. Sweating, fever, that's due to the heat. Constipation, that's due to the heat consume the fluid in the large intestine. The patient may present with yellow urine. The patient also may present with mouth ulcer, or especially the ulcer on the tongue, on the tips of the tongue. That's the heart location. The reason why the patient will present with yellow urine, or why we need to emphasize the urine, that's because the heart and the small intestine, which dominates the urine, dominates the water transportation is linked to the heart. So the heart fire can affect the small intestine, results in a urine problem. Painful urination with a burning sensation. As the heat from the heart goes to the small intestine. So for this manifestation, this syndrome, the patient will present with irritation, ulcer in the mouth, especially at the tip of the tongue, painful urination with a burning sensation. Also, this fever is not a mild fever, it's a high-grade fever. That's because of the fire. The rest of the three symptoms in the heart disorders refers to a more severe condition, the phlegm misting the heart mind. So the heart mind was affected, and then it will result in the problem in the consciousness, the mental confusion. In some other books, sometimes this condition is also cause phlegm misting the pericardium. They are exactly the same. The only reason that they use pericardium is because traditionally we don't think that the heart will have problem, because the heart is the emperor organ. The phlegm misting the heart mind, it will present as dull impression, cloudy of consciousness, or even unconsciousness, poor memory, mental depression. They cannot recognize their families, muttering to themselves, strange behavior. What kinds of strange behavior we have mentioned before? As someone can talk to themselves, or the other strange behavior, such as the description that the patient climbs up to the roof to sing, or walk on the street naked. This kind of strange behavior, when a patient presents with this strange behavior, then that means the heart mind already affected. The patient also can present with chest tightness. Some patients may present with sudden collapse. That's the unconsciousness. That's also due to the heart mind. So the key points, key manifestations of this symptom is mental depression, the mental problem, the thoughts, the consciousness, and then the phlegm syndrome. Greasy coating, slippery pulse, that's from the phlegm, especially if the patient presents with a thick greasy coating, and the unconsciousness, that's the phlegm. The phlegm fire disturbing the heart mind. So this and the previous one, the phlegm mixed in the heart mind. These two are all due to the phlegm. These two are also affecting the heart mind. So the manifestations will be very similar. The only difference is the fire. When the phlegm mixed in the heart mind, as more phlegm is an in-pathogen. Phlegm fire, after the phlegm stagnates in one area, it creates a fire because of the heat, it changes to a yang syndrome. That's the difference. That's the difference between the phlegm visiting the heart mind and the phlegm fire disturbing the heart mind. The patient may present with similarly unconsciousness with all the mind and the heart manifestation. The strange behaviors. We have talked about the phlegm, the strange behaviors that we mentioned previously. The patient may experience such as muttering to themselves, talk to themselves, but this patient also can talk to themselves, but they will talk loudly. They will cry loudly. They will climb up to the roof to sing loudly. That's because of fire is the yang. They can hit other people. This patient also can present with a mental problem, could not recognize the families. The patient may present with fever. There's also high-grade fever. That's due to the fire, the phlegm fire. The fire will result in dry mouth because the fire will consume the body fluids. And this dry mouth, the patient will prefer to drink. Chest tightness as the heart problem, red with yellow greasy coating. That's the heat. So this syndrome, the patient will present with the mental problem plus the phlegm fire syndromes. The last syndrome in the heart disorder is the stasis, obstructing the brain cholesterol. This is mostly due to the stagnant blood, and the reason why the brain problem we put in the heart is because traditionally we don't talk about the brain, and then the brain problem is due to the mostly linked to the heart problem, and then in Chinese medicine theory, the brain problem we think that it is the heart problem. In this situation, the patient may present with dizziness, stabbing headache. The headache is in a fixed area, insomnia, palpitation. So as you can see from the manifestations, these manifestations are something related to the head and to the heart. Insomnia, we also think that's the heart. That's because the heart's spirit and the heart in or fluids or heart blood were affected. The patient may present with unconsciousness, poor memory. So that's the something in the head plus blood stasis syndrome. These are the common symptoms and common symptoms in the heart disorder. As you can see from these two videos, that's when we talk about the Zang differentiation method. If you remember the previous differentiation method as well as the previous key points, it will be much easier for you to study the Zang differentiation method, because in this session we only combine with different content from the previous information, previous textbook or previous chapters, such as the heart qi deficiency or the phlegm misting the heart and mind, we only pick up the manifestations from a phlegm syndrome, and then we put in the heart problem. So in this situation, the patient will manifest as a heart problem and a phlegm problem, such as here, stasis obstructing the brain cholesterols. The patient will present with the head problem, headache, dizziness, and the syndrome of blood stasis. And the syndrome of the blood stasis is the content that we have studied in the previous differentiation method. The next one, we're going to talk about the small intestine. As you can see from the textbooks, thus in the Zang organs, the heart, the liver, the lung, the kidney, and the spleen, there are more symptoms, more different disorders of the Zang organs, and there are less symptoms in the full organs. The reason also because of our theory is more based on the Zang organs, especially based on the 5 Zang organs. Because the heart and the small intestine are paired organs, so we put them together, the small intestine. The function of the small intestine is to receive and digest food, separate the clear from the turbid. So the clear qi in the small intestine the food received and digest from the spleen and stomach transfers to the small intestine. The small intestine can separate the clear one back to the spleen, and then the spleen will transform to the qi we need to use. The turbid, the waste, can be the waste from the stool or from the urine. That's why we said the heart of fire can affect the urine. That's from here. That's the turbid, the waste. So that's the function of the small intestine. The small intestine, we're only going to introduce one symptom, excessive heat in small intestine. Mostly it will present as the urine problem. Scanty, dark yellow urine, painful urination with a burning sensation, or even bloody urine. But if for the bloody urine, you must remember that this situation must plus a red tongue, a yellow coating. That can indicate the heat, because the bloody urine also can be from deficiency. Then that's the other story. Here, when we talk about the excess heat in the small intestine, that's the heat. You have the red tongue and yellow coating. Again, here in these manifestations, apart from the urine or the urination problem, you also can see restlessness, insomnia, or red face. Why the patient will present with the heart problem? That's all the insomnia, the restlessness are the manifestations that we have mentioned in the heart disorders. That's also because the small intestine and the heart are paired organs. The small intestine heat also can transfer to the heart, can affect the heart. That's why the patient also may present with insomnia and restlessness. Also, that's from our theory. Also, more practically, you can think about a patient presents with painful urination and with burning sensation? Can they feel peaceful? Can they sleep well? So that's more obvious, but how to explain these symptoms? That's from the heart function, the relationship between the small intestine and the heart. So the key manifestations is the urine problem and the heat symptoms. So in these two videos, we have introduced several symptoms of heart disorder. The disorders came from a mild condition to a very severe condition, even life-threatening conditions, such as the phlegm fire affecting the heart mind, or the blockage of the heart vessels. Some of these conditions are life-threatening disorders. So when we see these conditions in clinics, we need to be careful. We need to think about what's the causes, what's the possible prognosis. In the next video, we are going to talk about the lung disorders. Thank you for your attention.